I am not an expert in virtually all of what we've heard and have learned a tremendous amount over these past 2 days. And one of the things that's been striking for me is that we've heard such similar messages coming from so many different parts of the spectrum, from science to social service organizations to the medical providers. And many of those messages and the lessons don't sound that complicated when you hear them. But the fact that we are hearing them from so many different places validates their strength. And so one way to look at this is to say, well, we hear a lot of the same things. But I think the important thing for me to take away is the fact that we're hearing the same things from so many talented people in so many different parts of the country, the world, different disciplines, really gives us a lot of learning that we can not only use but spread. So on this panel, I'm going to let them talk for a few minutes about what they do, but we do have people involved in identifying, assessing, and intervening where necessary to protect children in different places in different ways. And so hopefully we can come up with some practical thoughts to leave you with. Catherine, do you want to begin?
Good afternoon, everyone. I'm Catherine Grimm. I'm a general pediatrician and a child abuse pediatrician, and I'm the medical director of the New York Center for Children, which is located on 70th Street near First Avenue. My center originated in 1995, and the original intent was to do forensic evaluations of children suspected of abuse, particularly sexual abuse. But we soon found out that many of our children could not get quality therapy. And so very early on, I joined the agency in 1997. Our board approved a therapeutic program which continues until today. And I'd like to focus just a few things because I think there's certain essential ingredients in terms of a successful therapeutic program. And I think one of them is in big capital letters, nurture. I think it is so important for children to be nurtured in the process of getting therapy. And I think what makes our agency a little bit different is that we're very holistic in our approach. Our agency looks very homey, which is nice. It doesn't look very institutional. And we have a robust group of volunteers that provide homework help, and we have regular parties for the kids, including some really big parties. We set no time limits on the length of therapy for our children, and some of our children who have been with us and are discharged then will call back maybe several years later and say they would like to come back for additional therapy because, children have different needs at different developmental stages. But it's also important to know that not only are the children nurtured, but the staff are nurtured. And that's probably the reason why when recently an older teenager called up wanting to come back to therapy, that her therapist was still there. And as a result, because the staff are nurtured, and they're nurtured in different ways, they're nurtured by their supervisor, which is Dr. Ed Greenblatt, who used to be here at Mount Sinai, but they're also nurtured by the board that sponsors periodic dinners for the staff, and the staff do not have pressure on them in terms of the total number of clients they're seeing per week. And they are very hardworking, but they do not have that productivity pressure that some people have. And so our staff tend to stay a really long time. So I think these are such important things as part of helping children become resilient. Another thing that we discovered, and I've learned this through my many years of experience working with child abuse, is that frequently the parent has also been abused. In fact, I can think of very few instances in which I have been involved with a child, both at my agency and also here at Mount Sinai as a child abuse pediatrician, in which the mother says, oh, by the way, I was sexually abused for 13 years. I really think the statistics that are listed are really not accurate at all, because most cases of sexual abuse are never reported. So the child may come to us once or twice a week, but and the child may spend time with one of our volunteers and homework help and that. But we also know that the child's home environment needs to be nurturing as well. And so we have started also providing therapy for parents, because some of these parents just have never, ever gotten any help for themselves. And so it really becomes like a therapeutic agency for the whole family, not just for the children.
Thank you. Susan Morley is the Senior Advisor for Investigations for New York City's Administration for Children's Services, and has a very long career in law enforcement. Susan, why don't you talk a little bit about what you do?
Yeah, good afternoon. I'm Susan Morley. I'm Senior Advisor for Investigations to Commissioner Hansel at ACS, who you'll be hearing from later. I have the honor and privilege for the past 12 years of continuing my passion for protecting children, which began with the police department. I was there 21 years. I was a commander of the Special Victims Division, and almost every rank was in Special Victims. I know Dr. Grimm for a long time. And Jess was my first chief of staff when I went to ACS. So most people retire and go on a cruise or go to Florida. I went to ACS. So God. I am very thrilled by the title of this conference. I love Dr. Diaz. And
everybody loves Dr. Diaz.
Yes, everybody loves Dr. Diaz. And it's been my passion to try to end violence against children. And I run a unique program at ACS where retired law enforcement, detectives, detective supervisors are in the field offices with the workers, assisting them on complex cases, helping them gather information so that they can determine safety and risk. You know, investigations is a word that people don't like to say sometimes with child welfare. We like to talk prevention. I love prevention. I think prevention is the key. I would like no kids to have to come through our agency. I'd like to close our agency, that there wouldn't be a need for it. So the 0 to 3 population, to me, is a very important population. And we recently started a program. The commissioner challenged us to come up with an idea on how do we, out of the 60,000 cases a year that are called in and sent to New York City, child protective specialists to investigate, many of them are neglect cases, but how do we pick out those ones that are the most serious, that need the most attention, right? So the Commission to Eliminate Child Abuse and Neglect Fatalities studied this across the country, and they came out with that the children that are 3 and under are the highest risk for a child abuse or neglect fatality. And particularly if there was a call, whether founded or not, in the past to a child welfare hotline. So that got me to thinking, what more can we do? And working with our Division of Child Protection, our policy and planning, we sat together and we came up with, what if we have this great resources of the detectives, over 100 detectives retired, that have this skill, and if we pair them with the child protection supervisor, upfront an investigation when a child is 3 or under and it's coming in with a serious injury, and let them from the beginning, so the investigation starts out right, talk about what needs to be done to find out what happened here. And this is critically important because this is a group of kids that cannot talk usually, or if they can, it's limited and you don't know what happened. It's a group of kids that accidents do happen. Toddlers do bump into things. So if I'm an angry parent that pushes my kid and they hit their head on the coffee table and they get an injury, or the toddler trips and get the injury, they're gonna have that same injury, right? So how do we determine if this is an accident or is this abuse? And is this abuse gonna progress until we have a fatality? So we wanted to like combine that expertise of the child welfare manager and the retired detective sergeant, and put them right up front to give some guidance and advice, and then to bring them back together 30 days later after people went out there to investigate and were gathering information, right? So we thought if we focus on, for investigation purposes, on this group, it may help us to prevent some fatalities. Now, ACS is a big agency. We invest in preventive more than any child welfare agency across the country. We're contracted with 54 different agencies, over 200 different types of programs within those agencies. So it's just a piece of what we're trying to do to protect kids. We have some exciting partnerships going on with our sister agencies. There's one thing I have learned doing this work in 2 different agencies all these years, is no one agency can protect kids. There are a lot of people involved in kids' lives way before child welfare finds out about them. So I think like that public health approach is the way that we have to go, and ACS has a lot of pieces that we are doing with that. And I don't want to talk too much about what ACS is doing regarding the other things besides investigations, because our commissioner will be here, and I'm sure he will be talking about some of that. So I'll end right now.
Thank you.
And turn it over.
Alpana Patel is the program coordinator at Mount Sinai's Savvy program, based in Elmhurst.
Hello, good afternoon, everybody. My name is Alpana Patel, and I'm a social worker with the Mount Sinai Savvy program, where we provide free and confidential services to survivors of sexual assault, child sexual abuse, domestic violence, and human trafficking. In terms of specific services that we have for children, it includes our emergency room advocates, where we have trained volunteer advocates that respond to 7 hospitals between Manhattan and Queens, which includes cases of child sexual abuse. And we also provide free therapy services to children, as well as secondary survivors, which includes their families. We provide supportive services and counseling to them as well. And we also have a training and prevention education department, which does a whole array of services on prevention, but also specifically related to children and adolescents. We have age-appropriate programs and works with middle school and high school kids throughout the city, and on topics such as bodily autonomy, consent, and healthy relationships. So that's our program in a nutshell. And Savvy's approach is survivor-centered, but also in a very systemic approach as well. When we work with a survivor, including children, we also work with the various systems that the survivor interfaces with. So that can that entails when we're working with children in partnership with Child Protective Services, with law enforcement, with immigration attorneys, with pediatricians, with psychiatrists. Essentially, the best treatment impact is when there's synergy between all the different agencies that are working with the child. So we're creating the optimal environment, the healthiest environment for the child to overcome their trauma and thrive eventually.
Thank you. Jess Danhauser, do not be misled by his youthful looks. He's the CEO of Graham Windham, but also had a distinguished career at ACS before that.
Thank you, Rich. Good afternoon, everybody. Graham Windham is an organization that is serving about 5,000 children in the New York City area. We do a whole continuum of services, starting with serving about 300 families in one of ACS contracted preventive programs. We have several programs, some evidence-based programs that we're doing in-home family therapies to keep children safe at home. We just, on the preventive continuum, we also just opened ACS's first ever Family Enrichment Center in Hunts Point. The Family Enrichment Center model is a primary prevention model that is really consistent with what we try to do in Graham Windham. I'm going to pick up on the theme of trust that we talked about last time. It is a community center. It is embedded within the community center called The Point in Hunts Point, if you're familiar with Hunts Point. Anybody can come into this community center. You do not need a case with ACS. You We set it up like a very home-like environment. You sit around a kitchen table.
Hunts Point is statistically one of the more difficult.
Yeah, according to the
neighborhoods.
Citizens Committee for Children of New York, Hunts Point is the #1 at-risk neighborhood for children in New York City. What we have found there is extraordinary capacity, lots of systemic problems, but extraordinary capacity of families, lots of entrepreneurs, lots of ideas, and our job is to build on that capacity. We also, at Graham Windham, we have about 700 children who are in foster care with us, including 100 residents at our school in Westchester. We do a whole continuum of foster care supports, but throughout all of those programs, our work with family is primary. And then we do a number of after-school programs in the city and therapeutic programs, all together serving about 5,000 kids. What we've been focused on at Graham Windham is around this issue of trust. So we have kids who are at risk from violence, the whole gamut, right? So young age all the way to trafficking, which can start as early as 11, 12, 13. We think the best tool we have is trusting relationships with our young people. Those trusting relationships cannot be in isolation. They have to be in a community where there are other trusting relationships, because relationships, while they are what I believe are the greatest tool against violence, can also be used, and someone was talking about grooming earlier, can also be used to perpetuate violence. So it has to sit within a community. And we've been doing a lot of work to figure out how does an organization that runs various programs become a community and not just a service provider. That difference for us is the difference between a really effective organization and one that is just providing more and more service. And so we've done a couple of things in that regard. The first is we have created programs that ensure longevity. I don't know of any authentic relationship that ends when funding stops. I don't know any authentic relationship that ends at the most important transition in your life, when a child leaves foster care to go home or to be adopted or to go to some other family arrangement or to age out of foster care. If that relationship ends, if kids know that relationship will end, they will never buy into it in the first place. The same goes for parents. The moment your child comes home, who may have been in care for a number of years, who comes home at a different developmental stage, frustrated by their age and by things that they have been through, to let them go at that moment, in my view, is a sin, and is one of the reasons we don't have trust in our systems. So building those relationships, something called our Family Success Initiative and our Graham Slam Initiative, we have found that we're able to come up with better relationships. And then we have a saying, and we're really sort of thinking about this for the Family Enrichment Center, is help is only helpful if it's helpful. And what we mean by that is we have to be meeting a need. If we are just providing what we provide, rather than really listening to those we serve and arranging our services to do that, then we're not doing our job. So I echo a lot of what I heard earlier in the day, and those are a few ways that we're trying to make that happen at Graham Windham.
Isn't it interesting that we're talking about such basic words as nurturing and trust? And Catherine, you said a few things that were really striking. Oh, one with respect to nurturing. What does it mean? What is the key to successful nurturing? I mean, we all know what it means in a colloquial sense, but does it have some type of special meaning that guides your approach here?
I think that nurturing, that the person who's being nurtured, okay, knows that you really care about them, knows that you believe in them, knows that you're not judging them, knows that you have great potential, and that person there is there to be your mentor and helper. And optimally, parents should be nurturers, but sometimes parents don't know how to be nurturers. And so that somebody said earlier, that if a child has one significant adult in their life who really is nurturing them, that oftentimes breeds success. So sometimes that nurturer has to be outside of the home.
You know, one of the things, I heard a presentation recently, Jess was there, talking about building trust and nurturing. And the point that was being made was that it's not just a matter of nurturing and trust, but sticking with the kid.
Correct.
Because they've been so many of these kids have been let down so many times that you've really got to stay with them and show that you're going to stick with them. Jess, is that your?
Yeah, we have a young man who, I remember he called me one day. He was at our school and eventually came into one of our foster care programs. And he called me and he said, you know, what happens if ACS doesn't approve the extension to placement when I'm 21 and I'm still trying to get my feet under me? And I said, how old are you? He said, I'm 16. I said, why are you worried about that? You know, we'll make sure we take care of that when we get there. And as that day eventually came, his anxiety ramped up and ramped up and ramped up. And we had to literally tell him hundreds of times, I promise you we will be there. I promise you we'll be there. I promise you we'll be there. But we had to show it for almost a decade to this young man for him to really believe it. He'd believe it for a moment, and then he would say, no, systems end, people don't really care. So absolutely, sticking with people matters, and it takes consistency to do it over and over and over again for folks who've had a lot of instability in their life.
You want to address that?
Another thing that's also really important is letting them know that they're not alone, because when they have been through abuse for years, often, they feel so lonely. It's a very lonely, very isolating experience. So when they come to us, by creating these safe environments, by our presence, by the consistency, we're also sending the message that they're not alone. And if for whatever reason, services don't work out with us, they need something else based on location or whatever other barrier they may be having, then we will work with them to overcome that barrier and get them connected to the appropriate resources, and that they're never alone. I think that's a really important message as well.
Catherine, another point that you made was about the importance of nurturing staff. And I wanted to ask you about that because the people on the front lines of your organizations they have very stressful jobs. They're making very difficult judgments. And I don't think we talk enough about how you can nurture your staff, how you can demonstrate trust in them. How do you go about that in your organization?
Well, I think that it's really important for every staff member to know how important they are and to always know that there's somebody there as a backup. You know, our staff get very close supervision, even though some of them are very senior. They still have supervision. There's also peer supervision, where peers get together and discuss cases together. We have our own social events, which I think is really important.
What kind of events?
Like holiday parties, celebrating somebody's birthday, giving gifts to people for a variety of different reasons. I think people just know that the rest of the people in the group are there for them. And I think that's really important. I think, telling people they do a great job. Adults need to be nurtured. One time, I used to have a lot of faculty working for me here, and somebody said to me, and this was a faculty member who'd been here for a while, she says, nobody ever says anything nice to me. Now, you would think that a person sort of already knew that they were appreciated, but sometimes you need to hear those words, and I'm a big believer in nurturing parents as well. I think we have to cheer parents on and encourage them, and it doesn't matter whether they have a degree after their name or they don't have a degree after their name. People like positive feedback, and they like to know that they are cared about. Doesn't matter how much education they have.
Jess, what's your experience?
I think all of that, I think, makes a huge difference. I also think we have to think about this as a skill. So respect is our first organizational pillar or value. And in the beginning, I thought, everyone should just be respectful. We should all be empathetic. But as soon as I started to think about it as a skill, and it's easy to be respectful in theory, it's a lot harder to be respectful when someone's screaming at you and telling you that you are the worst person that's ever come into their life, or criticizing you at the end of a long day where you think you've done a really good job, and you have. And so we've tried to begin to teach that with that understanding that let's put ourselves in scenarios where respect is really hard, and let's celebrate folks who were able to keep it together. And when you make a mistake, it's treated as such. There's obviously a line of behavior that we all have to follow as professionals, but we also need the opportunity to learn from mistakes along the way and to create an environment as an organization where that's allowed.
What do you do in order to create that environment, and how do you go about teaching it?
A lot of it is peer support. So we have a model that was actually created, I believe, in prisons to do peer support, and it's called Network. And it's a 4-part model, and it's peer-based, peer-facilitated, and folks, there's an affirmation part, and then you put stresses and concerns out. And no one's allowed to give advice. You're only allowed to say, when I was in a similar situation, I did this, and it worked or it didn't work. And that peer support, so if someone says, the last time that I was screamed at or threatened with violence in my job, this is how I handled it, is much different than me getting up in a lecture and saying, this is how we are respectful or empathetic at our organization. So one of the ways is a deep investment in
And do you use that across the agency?
We do.
Alpana, do you want to address this? You don't have to. Susan?
I know the commissioner is very concerned about staff. They have one of the most difficult jobs in the city. They're on the front line going to homes where cops will not go alone, and yet child protection workers often do. So he's very committed to getting them not only the training they need and the tools they need to do their job, but their well-being. And he recently hired a well-being coordinator. We're running different workshops for staff towards well-being, towards their health. He goes out directly and does town hall meetings so he can hear directly from the staff of what they need, what's going on out there. And he holds the leadership of the agency accountable, shares with us what he's hearing from staff. And not only that, he's taken action about moving the agency to give the staff not only the support they need to do their job, but for their own well-being.
Susan, you mentioned something about the tension between the dire need to protect children against violence and the risk of unnecessarily ripping children apart from their families. How do you train your investigators to strike that balance? And do they operate with a presumption when they go in?
No, they're not operating with presumption. It's really one of the most difficult jobs, and that's from the former Special Victims Commander, right? These workers, day in and day out, have to make decisions about kids' lives that will impact their lives maybe forever, right? So picture somebody graduating, social work school and going out there and having to make a decision like that fairly quick. And the decision that night has to be, should I take this child from their home? Is that going to cause more trauma? Or if I don't take that child from the home, is that child going to be killed or hurt or burnt or bones broken, right? And it's not easy. Well, we try to train to get as much information as you can. You have to engage the family. You have to engage the mom. And the moms you deal with sometimes don't even know about the man they might have brought into the household, right? So sometimes the information we find out during the investigation could be very concerning. He's watching the child. He calls mom who's working and says, oh, the baby got hurt today. Mom only knows that story. She has no reason to suspect anything else, right? But it's the investigators, the child protection specialist's job to try to find out what happened. Mom's not lying to the child protection specialist when she says, oh, the baby fell, right? That's what she was told. So it's getting to the real source of the info. How do you know the baby fell? Did the baby fall? And we rely a lot on our medical partners to help us, especially with the younger kids that can't tell us what happened. Could this injury have happened the way they said it happened? And even if it could, we're still not really sure many times, is that the way it happened, right? And so when you start looking at stuff that you can pull together, now if I look at mom has a new boyfriend and suddenly the kid's getting all these marks, and mom says, oh, he told me the baby fell this time, he told the baby fell that time. And I'm able to access databases that say, you know what? He had another girlfriend that he hurt a child with. He hurt a girlfriend before that, or he hurt his little nephew before. Now that's given me more pieces of the puzzle to try to talk about safety with mom and having to make decisions. But there is a shortage that we need help with of child abuse pediatricians that have the subspecialty in child abuse. There is a real shortage across the country. We're better off in New York City than a lot of the places across the country. But the CACs, I'm a big believer of them. I helped create them. I've done that work without having CACs. I've done the work where I had a child advocacy center. So in the 90s, in the height of the crack epidemic, when I was Sergeant Morley, I had to be social worker. We weren't at a CAC. The police department was the social worker, the investigator. So we've come a long way in this city in these investigations. We really have. Those of that's been around a long time, and we're collaborating better. But the job itself, when you're trying to determine how a child was injured, especially the young ones that can't tell you how, it's not easy to figure out. And
Now, sometimes these decisions have to be made pretty quickly.
Yeah, because
who
you
makes
you gotta decide
Right.
if that child's an imminent risk or not.
So who makes the decision? What's the process by which you come to the judgment?
Well, if the child's in an imminent risk, you have this child protection specialist is going to call her supervisor, and the supervisor will decide. If we do not believe the child's at imminent risk, we'll make a safety plan for that night, and they'll have what they call a child safety conference, where the parent gets to bring their resources with them if they choose, and we meet with the family to decide, if there's concerns about the safety of this child, is there a way to keep the child safe in the home so a removal does not have to happen? And what does that look like? Does that mean, grandma is going to move in for a while until we figure this out? Does that mean the mom agrees the child's going to go stay with grandma for a while rather than ACS removing the child, right? The majority of investigations, the children are not removed. The problem, with media is, especially with ACS, it's if you don't remove the child, you're terrible. If you remove the child, you're terrible. Right. So it's a difficult job, and I am in awe of these child protection specialists that come back and stay with the agency for years. I really am, and I think it keeps me from still working instead of retiring because I keep wanting to help.
Jess, do you have to deal with these same issues in your agency?
We do, especially in preventive services. In foster care, the decision is so clearly with the judge that a lot of that is presenting facts and giving our perspective and assessment. But especially in home families, preventive services, where you're working, I think it's the highest risk work that we do in many ways. depending on the type of preventive services, you're in the home either twice a month up to 6, 7, 8 times. And I believe that all preventive services should be much more intense than a couple times. Developing that relationship at the outset, making sure that you do have to really build a trusting relationship in order to get the right information. We have more time than the child protective specialist who's done an immediate investigation. Our job is to help families build the capacity they need to protect their children. And that works in the great majority of cases. About 2/3 of the families we work with graduate from our preventive services. And 99% in the last year of those graduates, children remained out of foster care.
Why do they get into your program to begin with?
Typically, a child protective specialist will determine that there is a level of risk, perhaps abuse or neglect happened, there's an indication that maltreatment occurred, but they don't believe that risk rises to a level that the child has to be removed, and so they turn to one of 50+ preventive organizations based on the program type. So we have a varied range of types, and based on geography, so we're in particular neighborhoods throughout the city, we'll get a referral to preventive services and begin working with that family, which often, even if the investigation is done as well as possible, the threat of having your child removed is so deeply painful and scary that process of building trust is one that needs to be really intense in the beginning.
And Catherine, how do you interact with ACS?
Well, I'm the person who gets called to help make that decision, actually. Usually these are children who are admitted to the hospital with very serious physical injuries. And the question is were these injuries inflicted or were they accidental? And that's many times where I become involved.
I see. So we have 10 minutes. I'm going to ask the panelists what their greatest wish would be in a practical sense. But first, are there any questions for anybody on the panel here? Okay. Catherine, why don't you start?
Can I give 2 wishes?
Oh, I'm sorry, I didn't see.
And I'm just a family doctor. And I was wondering, we heard so much about child abuse and all these victims. Can you speak something about the perpetrators? So there must be just as many people who are doing it if there's so many victims. So how does this happen? How does the victim get kind of hunted down that, they think they can get away with it, obviously. How does that happen? Any comments?
Mm-hmm. That's a good question. Susan, do you want to?
So, I think the doc would probably agree. Sometimes these parents or, the boyfriend or girlfriend, they were victims themselves of abuse or domestic violence. Sometimes it's the young parents and frustration. The boyfriend's left to babysit the little baby, and the baby's crying and crying and crying and crying, and they don't know to walk away that a baby never dies from crying, but a baby will die from you shaking the baby, right? So it's education, I think, and parenting classes and all that, I think, comes into play. Over the years, potty training. Parents get very frustrated, especially if there's rules to get in the daycare or the school they want to get into, right? Get very frustrated over the potty training in her kids. So it's sometimes low tolerance, anger management and all that, and they snap, right? I don't know if you want to add, Doc?
No, I agree to that. In most cases of serious inflicted child abuse, I don't think people really intended to hurt their child or kill their child, but they just lost it. And that brings me to my 2 wishes. I'm going to do 2 wishes, okay? One wish I have is that
you can have one of yours and you can have mine, too.
Okay. I think that there are so many good things that happen in this city, in this country, that are grant-related. But I think that there are some things that should be entitlements for everybody, okay? And 2 of the entitlements that I think should be for everybody is that I think that every school-age child, starting with pre-K on up, should get, begin getting training about how to live. They get training on how to read, and they get training on how to do math, and they get geography and social studies, but they need to learn how to talk, as a group about the everyday challenges of living, such as bullying, cyberbullying, what to do when you see, what do you do when you see one person being mean to another person, and that type of thing. And what are some danger signs that you should try to avoid? I think that it has to be over a continuum. And when my daughter was in middle school here in the city, one year she had focus groups. But that's not universally done, and I think that's a very inexpensive thing, and what's great is that kids begin talking to each other, which I think is really important, and they also begin to learn how to talk about things. A lot of the cases of sexual abuse that we see happened years ago, and the child has not disclosed. And there's a lot of reasons why children don't disclose. And then sometimes they tell their best friend, but their best friend has been sworn to secrecy, so their best friend doesn't get them help either. So these are the kinds of things that I think can be talked about over a continuum. The second wish that I have is that every pregnant adolescent gets quality therapy, irrespective of what hospital her child is born in, and irrespective of the neighborhood she's in. There's lots of wonderful programs. There's a nurse-family partnership, but a lot of kids do not profit from that. There is Healthy Families New York, which is a grant-funded, neighborhood-based program, but not all neighborhoods have that. But these kids, these young teens really need to be nurtured and really needed to be supported, and we need to find ways of doing that through home visitation and other programs. Home visitation is a proven way of helping young families. And I've been on the Accountability Review Panel now since 1997, and that's sort of like the ACS Fatality Review Panel. And what kids are dying, okay? Almost all the children that we have evaluated have died in homes where the mother had her first baby when she was 21 or younger. I think there's a message here. And almost all the consults that I'm doing here at Mount Sinai are with young parents, including a recently death. So I think that we need to put more and more focus not only to prevent adolescent pregnancy, which I know the Adolescent Health Center is really trying so hard to do, but once it happens, how to handle it.
Susan made, I think, an important point, or raised an important issue about the perpetrators. I mean, to what extent, they're doing, some of them are doing evil things. To what extent are they just people who are losing it, people who are frustrated, versus evil human beings? What is your experience?
My experience is that it has a lot to do with stress, isolation, the inability to be in relationship to others where you can have resources, and behavior that comes from that. This is sort of maybe more on the spiritual end, but I think it comes from a lack of being heard. So I'll use this as my wish. My wish is that we get better as a society to listening to our kids. And we're going to hear a lot of kids tomorrow. But kids in general are experts in their lives, and I don't think we treat them as such. And they know whether they're safer at home or somewhere else. They know exactly what they want. They know their dreams. You mentioned potential before. No young person wants to talk about just what they are. They want to talk about what they're going to become. And so if we can all, as society practitioners, find a way to really respect what kids are saying as truth, I think we'll be better off in protecting them.
Alpana?
So one of the things that I think is really important is that we really have to value children and women and populations that are marginalized and vulnerable and at increased risk for sexual violence and violence in general. And I think that is, going to be a huge contributor to reducing violence, which is an epidemic proportion. And in terms of my wish is that I really hope and wish in all these conversations that we're having about ACE and the impact of lifelong impacts and the brain studies and the neuroscience of it, is that we really move towards a public health approach to dealing with this. Because once we start looking at it from a public health perspective, we can look at all the vulnerabilities that cause and drive the epidemic, which includes not valuing vulnerable populations, includes poverty, includes these huge structural issues, and it can point to the lack of attachment in communities and families that lead to create these risk factors. So I think that is something that I really wish and hope that we move towards.
Thank you very much.
Susan gets a wish?
I think we're getting booted.
I don't get a wish.
All right.
No, I'm going to say it quick, and it's reinforced, and I have the same wish that Jess has. I wish they would listen to children, particularly when they're ready to disclose sex abuse. And I wish we pay attention and not quickly walk away when they recant. Because a lot of the recantations are because of the pressure of the system. They told somebody they trusted, and because that person they trusted is a mandated reporter, the system kicks in no matter how sensitive we try to make it. And pressures to recant go on, and then kids wind up living sometimes in that abuse simply because they recanted, and we didn't all take the time to really look at that recant closely.
Thank you.
Thank you.